Hi guys, Dr. Berg here. In this video, we're going to talk about how to fix a beer gut. Okay, do you have any ideas how to do that? You got it. You cut out the beer, right? Well, a beer gut or a pot belly or a basketball protruded belly, usually in men, but it can happen in females. You know, you've seen the guy on the beach with the Speedo with this pot belly with skinny legs, right? Skinny arms. It's not fat usually. It is ascites. Ascites is a fluid-filled sac or fluid around the gut. There's a space between the organs and the inner skin, okay? It's called the peritoneal cavity. That thing fills up with fluid because the liver is leaking fluid because it's damaged. The liver is dysfunctional. Usually cirrhosis, that's when you have normal liver tissue that's replaced with scar tissue, okay? So it's a lot of fibrosis. And then you lose the function and then it starts leaking fluid. It can also be congestive heart failure, but it's this pot belly. If you take your hand and one side of the belly and you tap the other side, it'll like create a little ripple. It's all fluid. And what they do is they drain the fluid for like a week and it comes right back because no one's fixing the actual cause, which is the liver. They usually have high blood pressure. Other symptoms related to this as well, swollen legs, yellow skin, the whites of the eyes are yellow, dilated veins in the esophagus. So a lot of times when they swallow food, the food gets stuck in the esophagus, in the back of the throat, because they have this dilated vein that is obstructing the food from going through. And it's actually coming from the liver. Also low testosterone, decreased libido, decreased erections, high estrogen, man boobs, okay, and ascites. Not a good combination. Okay, so what are you going to do to fix this? Number one, there's an enzyme called serrapeptase. I would get it in the highest form possible, like over 120,000 IUs. I would take it 3 times a day on an empty stomach. What this will do, it'll help get rid of excess scar tissue where it shouldn't be. It's a great remedy, but you also have to change your diet or else it's never going to work. So you need to eat a lot of vegetables, a lot of salads and cruciferous vegetables, at least 7 to 10 cups a day, because you cannot fix the liver without the raw vegetable, all the enzymes, all the nutrition in that. It's impossible to fix the liver. Keep your protein between 3 and 4 ounces, not these huge Texas-style steaks. You want to keep them small amount of protein, high quality protein, probably wild-caught fish, pasteurized eggs, grass-fed, meats, things like that, but don't have a lot, just a little bit. But you can have healthy fats. So I'll put a list down below of what that means. And then you need to do 2 or 3 meals a day with no snacking because we want to correct insulin resistance. If you have a beer gut, but you don't drink beer or drink alcohol, it's probably from foods that are raising insulin, okay? And that can create the same problem. It can create a fatty liver and in addition to cirrhosis. But anyway, you want to do 2 to 3 meals with no snacks. Okay, I'll put a link down below of more data on that. And also, choline is a great remedy to take if you have a fatty liver. Okay, so you could take that over time, and it actually strips down fat off the body. So anyway, I just wanted to give you a solution to that, and go ahead and apply this and put your comments below. Hi guys, hey listen, I created a pretty amazing evaluation quiz down below that actually analyzes your symptoms to find the cause, the root cause of all of your symptoms, the most likely cause. So take the quiz now and we'll send you a report.